Vaibhav is also joining in a minute.
Yeah, Puneet.
Hmm. So we are live, are we?
Yeah,
We are live, right?
yeah, we are live.
Good morning, everyone. Those who have been joining and listen, if they have been listening to me, we are still having a 7 minutes to start. We are hopeful to start uh, at 11, 11 in the morning. Yeah. Thank you. Minutes to start. We are hopeful to start. Hi, good morning, Vaibhav. We can't hear you, Vaibhav.
Can you hear me now?
Yeah, Vaibhav, we can hear you. Good morning. We are currently live. The people have been joining in. We'll start in another 5-6 minutes. We have also streaming this on the on our YouTube channel.
That's great. Good to hear me. Thank you very much.
Thank you.
I'll share my screen. Can you check that
Please do.
this is
Please.
visible? I can't share. Can you give me rights for that?
It would
Yeah,
be
now you can share.
Vaibhav, try.
Can you see my screen?
Yes, we can see. We can see that.
Now it is full screen. So can you see my full screen?
Yes, we can see that.
That's great.
Vaibhav, you may like to disengage the screen for the time being.
Okay.
Yeah. Thank you. Good morning, sir.
Good morning, Puneet. How are you?
I'm very well, sir. I'm very well. Just waiting. So we have been live, and it's 11 in the morning, 11 a.m. So would it be fine if we start and the people would keep joining in by the time?
Yes, we can
Yeah.
start. Hi, Vaibhav.
Yeah.
Hi, Jay, how are you? Very good morning to you.
Thank you so much, Vaibhav. Good morning.
Okay. So with the permission, a very warm welcome to all the attendees, to all the participants in this in the webinar of managing the indoor air quality. This webinar we have been organizing as a part of the Harit Prem Bharat Mahotsav. And this Mahotsav, every year we have been celebrating a week-long celebrations from 23rd to 29th of January in the memory of Dr. Prem C. Jain, who's been known as the father of green buildings in the country. In this entire week, we have been having a numerous program, and this is one of them. In the subsequent days, we would also be continuing these programs till 29th of January. A very thought-provoking and interesting topics would be there. So would request you all to join there. Now, coming back to this particular program on the indoor air quality, the people who have been in the northern states of the country, they have been well aware. A lot has already been written, talked, been part of the news since many years. Especially in the last 4 to 5 years, everyone has been focusing, and I believe in Times of India, we have a permanent column which showcases that what is the average IAQ of the city, at least for the Delhi edition. That shows that how important the air quality plays a very vital role in all our lives. Earlier, we used to say that to have a proper ventilation to improve the indoor air quality. So whenever you have been facing certain issues related to the air quality, we have been moving out to get more fresh air. But especially in the winter months, these states people have been asked to remain indoor because what we consider the external layer, which is more fresh and good quality, has been deteriorated to an extent that it becomes harmful. And in certain cases, certain days, it becomes hazardous. Earlier, we used to use the word hazardous only to the acidic component of a batteries or electronic components, but now even the air become a hazardous. So on this, how we have been managing our indoor air quality when the exterior quality is too bad to be live in. So the next 60 minutes we have been dedicating on taking certain aspects how we may manage. Now, before asking Vaibhav to come up, I would like to welcome Mr. Sachin Sharma, Chairman, IGBC Western UP Chapter, to share the initial thoughts. Just a very brief of Mr. Sachin Sharma. He's having more than 20 years of experience in terms of a project planning, execution, and development, not only in the India, but in the international market also. And he's been working with the large developers. He's been handling the integrated township, the large commercial projects, be it the Wave Infratech or a Hindustan Limited, DS Constructions. Without taking much time, I would request Mr. Sachin Sharma to set the context. Thank you. Over to you, Mr. Sachin.
Thank you very much, Puneet. Ladies and gentlemen, a very good morning to you all. And it is my pleasure to be a part of this webinar on managing indoor air quality. And I welcome you all on this webinar. The ongoing pandemic is pushing this industry, in fact, to a new normal. And in these very challenging times, healthy buildings have come out as a part of a solution to cater to a safer and comfortable, living environment where we all are, living. Adopting concepts of health and well-being for occupants has become the need of the hour. And in fact, COVID has forced us and taught us how to spend most of the time indoor. And this has raised the importance of the indoor air quality, what we are going to discuss today. In fact, in last several years of research, and there is a growing body of scientific, bodies which has actually explained through evidence that how the indoor quality is affecting seriously our health, and how the bad indoor and outdoor air is actually, taking toll on the health of whole generation of people in last, few years, how they have affected everybody, and thus I think that the indoor air quality is playing a very, very important role when it comes to designing of the buildings, and when it comes to putting up a sustainable design for a building footprint, which is being done by various architects all across the globe. In addition, what has happened, AQI has become the new norm of our life. Once we are at home, we keep on looking at AQI. What is the AQI in my house? What is when I go to my office, I look in my car. There are filters even in car today. What is AQI in my car? Then my kids reach in school. Then I say in the evening, ask my kids, what was AQI in your class? And similarly, when we go to office, we look at AQIs. So these air purifiers is the real solution? Is it the real solution, or we have to do something else, or we have to keep on looking at these AQIs? So these are the kind of challenges which we have to see in future, how we are going to emerge out of it, and how we can take care of our health by proper management of indoor and outdoor air quality. That's what we are going to discuss today. I'm pleased to mention that IGBC is working very hard to support all the stakeholders to create a short-term and long-term solution, and preparing projects to adopt this new normal. And as a next chapter of the green building movement in India, it is very vital to understand the relationship between occupants' health, well-being, and built environment. That's one of the most important aspects of the building design element. We are extremely happy to inform you that IGBC has developed an exclusive rating system to address the people-centric design, which is primarily focusing on health and well-being components, which will be integrated in the design element of the building. And these design principle will actually not only be incorporated at a construction stage, but it will be also implemented once people start living in, and once the occupancy comes up in these buildings, and these will be continuously monitored also. So these are the kind of elements which IGBC is pushing along various stakeholders. These guidelines include very important concepts of monitoring, measuring, maintaining good indoor air quality, which includes enhanced visuals. Then we have acoustic and thermal qualities which need to be built in a building, apart from quality of water and other policies which impact the building footprint as a whole. IGBC is working with its stakeholders to recognize that health is of paramount importance, and the way people function reflect their connection with the surroundings and environment they live in. Healthy living practices are very, very important, and which helps in awareness creation among occupants on their own sustainable footprint which they will create in that environment where they are living. Improvement in built environment is very, very important, which is impacting the health of all the family members who are living in that building. Positive impact on health of occupant is also very, very important. There are lower sickness rates, spreading of diseases is less if we are living in a very positive and healthy environment. There is an enhanced fitness level of the occupants who are living in a quality indoor air environment. If we have a good air quality, it reduces the health hazards, and the non-communicable and communicable diseases also doesn't spread. Improved quality of life, health, and well-being is the result of good quality air if we live in that kind of environment. There are a lot of financial benefits also which comes out with this kind of quality living, which includes improvement in your productivity, improvement in your emotional quotient, improvement in your the way happiness quotient, I will say, and then improvement in definitely your expenditure also reduces, because your medicals will be less if you are not prone to diseases. Some of the trending healthy building features that are coming up in various buildings is that we are controlling and providing improved indoor air quality. Then we are improving the daylight and visual comforts which are there in the building. Then we are controlling the glares which come from the facade. And apart from that, we are creating environment around the building which involves in creating a conducive indoor and outdoor quality. We have today Mr. Vaibhav Goel, who is expert on indoor air quality, and I would like to welcome him and take on this session further. And we will be very happy to hear more from him, and then we can have a question hour session at the end of this. Thank you so much. Thank you, Puneet.
Yeah, thank you, Mr. Sachin. And that was, you have set the tone right, that what all benefits we can have when we have been working in the healthy environments, which has been achieved with the proper indoor air quality. So that's been very nice to you. Nice of you that you have explained that what all the benefits in terms of the physical, mental well-being, so that it would ultimately improve the quality of lives. Now it is my time to welcome Mr. Vaibhav Goel, who is our subject expert on the indoor air quality, and he's been having more than 15 years of experience at various organizations, driving this movement while living in Delhi, but still working towards managing the indoor air quality, and also been to a part of the outdoor air quality program under UNDP. So without taking much time, let's hear from Vaibhav. Vaibhav, you may like to share the screens. And by the time Vaibhav has been sharing the screen, I would request all the attendees to please use the chat box or a Q&A box very liberally. We would like to take this question and answer at the end of the presentations. And we have allocated a good 20 minutes for the Q&A. So we are hopeful we would take as many as possible. Thank you very much. Over to you, Vaibhav.
Thank you, Puneet. Sharing my screen.
And I would like to mention that Vaibhav is very, very generous to be here when when we approached him to come for this particular important session. And please pardon me, Vaibhav. Vaibhav has been down with the COVID Omicron virus last week only. And despite the fact he has he's been recovered, but not fully but I believe that we won't see any lacuna on the energy and the passion what Vaibhav is carrying while talking about the air quality. Yeah. Thank you, Vaibhav.
Very good morning to all of you, and thanks to IGBC, Indian Green Building Council, and of course, while remembering Dr. Premsi Jain, who is the father of green buildings and sustainability in India, especially in this part of the world. I would like to thank to all of you, especially Puneet and Sachin, who is with us on the panel. And here the topic is managing indoor air quality, and I have tweaked a little bit around the topic because I just don't want to mention that only how to manage the indoor air quality. We have listened to Sachin when he was setting the tone for the presentation today and the webinar, that what are the benefits to the occupants, what are the benefits to the living beings who are actually living inside the buildings, and this pandemic has forced us to live inside the buildings, whether it's your office or whether it's your home, especially the home, while we talk about the pandemic. So, of course, we need to know the benefits of anything which we do in life, but why we are doing that and where it is important and how to do that. It's basically the key to indoor air quality, because air is invisible. And today, the most important task to handle the air is something which we want to make it visible. And how to make it visible, how to make it pure air, or a kind of air where you can live, where you can survive, and where you can survive without any contaminations. So contaminations, how many different types of contaminations are there, where you need to focus, and how you can do that. Before that, particular session of this webinar, I just want to take you through why we need to do all of this. Are we really into a situation where we need to think about indoor air quality, and how does that impact on humans' health? It's basically when Puneet was talking about the northern states, northern belt of India, I just want to inform you once again that it's not only northern plains of India, now it's everywhere. So we need to focus on, while we are talking about the air quality, how much air you are breathing in and how much you are exhaling out, and what kind of air you are breathing in. So it's very important that where are we living right now. The 10 most polluted cities in the world. I hope and I'm sure that most of you as audience and as listeners would have heard about this, that the most polluted cities, the topmost list of the polluted cities are presently in India. And that's the unfortunate part, and that's the portion of, I would say, the problem where we need some solution. And it's not severe only in Delhi NCR or the northern plains of India. The 6 consecutive days, was the first time when we saw that 6 or 7 consecutive days in Delhi, the air was hazardous and AQI was very, very bad. Whether you talk about Mumbai, whether you talk about Chandigarh, whether you talk about any city, there are some green signals where we are getting some kind of AQIs in some gaps of the months. But however, the average AQI in most of the cities are very bad. What are we talking about in terms of pollution? It's not only the pollution where we are talking about only PM 2.5. The PM 2.5 is one of the contaminant where we need to focus on, because it can go into your body through the lungs and through the bloodstream. But when we talk about the pollution as a whole, we need to think about that what kind of pollution we are breathing in. And today, nowhere in country I can say that pollution is less. I can't talk about those cities where the pollution is very less. Yes, there are few times, rainy seasons, there are times of pleasant weather, monsoon seasons, where you can get rid of bad AQI. But here I want to show you that if you talk about the city of Bangalore, it's the heavy city with heavy vehicles on roads and traffic jams. We all have heard about the traffic jams of Bangalore. So nitrogen oxide and sulfur dioxide and even the sulfuric acid is on very high side in Bangalore state. Yesterday, I was reading the newspaper and they were talking about Mumbai. Mumbai has even gone up in terms of AQI this time. And there were 2-3 days in the past week when Mumbai's AQI was higher than Delhi. So you can think about that if you're living near the coastal region, near the forest, doesn't mean that your whole AQI, your whole subject of pollution has gone away. So it's the matter of time where we need to focus on each and every pollutant. And that's why we are bringing up this very important topic today. Nitrogen oxide in Bangalore, even the high pollution side of Mumbai and Lucknow. Interestingly, the World Health Organization and many other international institutes where the health is given an importance, and today they all are talking about deaths from different sources, and that source might include the HIV, the road accidents, the obesity, and they have categorically opted off air pollution, also one of the sources which can cause death. And they have categorically mentioned that categorized into 2 parts, outdoor air pollution and indoor air pollution, which is a very interesting part that till 2016, nobody was caring about indoor air or outdoor air. There was no differentiation. As of now, and today, they have made a very separable differentiation between both these things, outdoor and indoor, because how we live inside the building and where we are living at present, that makes the whole point. And where you can see that 3.8 million deaths have occurred due to indoor air pollution and 4.2 million due to outdoor air pollution. This number can go up if we don't take care of the indoor air spaces, indoor spaces. When we talk about the indoor air quality, we need to understand why I'm talking about only indoor today. Why we are not focusing on outdoors, when outdoors is the source, where you have the control, where you have the objective control on the airspace, the volume is fixed. I can control the contaminants. And that's why we are looking at indoor air quality as a special subject. And when we talk about our time spent in a whole day, in whole 24 hours of time, we spend 90% of our time indoors, whether it's your house, where you go after the office, whether it's your office, whether it's your car. Car becomes a kind of indoor space when it is closed from all the windows and it is just running on the roads. So it is an indoor space for you while you're traveling to your office or to some other project site or any other meeting space or anything. So that becomes your indoor space. And when it comes to your gym, your restaurant, your hospital, clinic, anything which is indoor is something which you are spending 90% of your time from 24 hours. And that's why we need to bring this topic. And Sachin was mentioning about the loss or the kind of capital loss, or I would say revenue loss, when it comes to consumer and the businesses, when it comes to absenteeism in the classes or in the schools or absenteeism in the offices. Then we are already, 2019 data is showing that 130 crore working days have been lost due to the absenteeism. And absenteeism doesn't mean that it might be due to some other reason, but most of the important reasons is indoor environmental quality. Indoor environment is the most specific area where we all need to work. While we are working on green buildings and saving energy and water, we need to think about the occupants. And why we need to think about the occupants, as you know, from the pandemic days, we are learning so much about wellness. We are all learning from the health and well-being perspective, that we all need to take care of our health in terms of everything. While you are jogging, while you are doing yogas, while you are doing taking food from outside, taking water from outside, how much you are controlling yourself and what kind of state you are living in. So the wellness is today, if I call wellness, it's a key mantra for every one of us. And that's how the architects, the consultants, the project managers need to think about the occupants and the people's wellness while they are designing the buildings. That's what we are going to talk about. Does air matter for healthy living? Yes, of course it matters, because this is the largest component going inside the body. And I would just give you an example through this pie chart, that how much food you intake and how much water you intake. And you are so much worried about the rotted food or any food which is coming from a thela or some other small shop. You are very much worried because that is visible. That is you can see the food, you can smell it and taste it, and that's why you are so much worried. And 0.75, that is 750 grams in a day you are taking as a solid food. If I convert liters into kgs, then 1.5 kgs of water you are drinking. You are very much curious, you are very much sure, you want to be sure while taking a water bottle from any shopkeeper, whether it's a Seal, whether it comes from Kinley or Aquafina or any other brand like Catch and Himalaya, you want to be very, very sure. But what about the air which is going inside your body every second? 15 kgs in a day, an adult would breathe in 15 kgs of air, which is invisible. And we are not concerned. So is that the balanced diet or the balanced feature of our life? If it is not, then what needs to be done? And we need to be cautious about the broad buckets of the pollutants while we are talking about the whole subject of air. And that's why I always say to my clients, to my juniors, seniors, co-engineers, and everybody on the team, that beware of air. Wherever you are going, you need to be sure that what kind of contaminants you are going to inhale, and you are living in that environment. When we talk about the air, there are three kind of pollutants. Let us assume that there are three buckets lying in front of you, and those three buckets are actually named or labeled as three different types of pollutants which are going inside our body while we are indoors or even the outdoors, mostly indoors, and somehow whenever we are stepping out also, the gaseous pollution, the particulate pollution, it is not going down. So particulate pollution, yes, it's thanks to media, as Puneet was mentioning about Times of India. Yes, Times of India, HT, Economic Times, all of them are creating buzz around it, and they are giving us awareness about PM 2.5. PM 2.5 is nothing but the particulate matter, which has a size ranging from 0.3 micron to 2.5 micron. So that's how the range of every particulate matter has been, I would say it has been break down into 3 or 4 particle stages also. And that's how we define that what harms you in a long run, what harms you in short run, and how you need to escape yourself from this kind of exposure. When it comes to gaseous, you know that vehicular pollution is going high and high every day. New vehicles are coming on the road, especially when our government is very much aggressively doing campaigns on electrical vehicles. We can see that most of the vehicles are still, people are buying diesel and petrol vehicles. And that's why NOx and SOx and the VOCs and ozones are very high on the Indian roads. And that's why the cities where the particulate matter was low, it is found by the agencies like CSE and TERI that the gaseous pollutants are going very, very high on in those regions. And that's why the particulate matter is also started increasing. And following that, we need to learn about these gases, particulate matter. Of course, the long and short-term health impacts are there, and we need to minimize the exposure to these pollutants. When it comes to microbiological, I need not to explain too much on this because everybody is now familiar with the term virus, and COVID has given us so many lessons, so many insights about this. The virus is something which we need to fight with, and we need to create awareness how you can't have the space where you can say that 100% it is non-COVID space. So when it comes to the virus, we need to be very, very careful in selection of the space and in creating the space where I can say that the chances of having virus infection from that indoor air is at minimum stage or is at minimum value. So that is how you need to create your spaces. That is how you need to think about it. And that affects our immunity. Everybody knows nowadays with respect to the virus. I just want to show you this chart, very interestingly made by the company called IQAir of Switzerland, where they have defined that how it is affecting your body and how it is affecting what kind of particles go into which part of your body and how they are affecting. The coarse dust particle, the largest bracket where we can see that the particles ranging from 100 micron to 10 micron to even 5 micron, they are called coarse dust particles. And you sometimes have eyes irritation, nose irritation, some throat irritation. That is because of coarse dust. When it comes to fine particles, we all know that 2.5 has been majorly talked of, and 2.5 is nothing but ranging from 0.3 to 2.5. So it can go into lungs, and that is why lungs have been added here. So the impact on lungs increases when it becomes the air pollution through the fine particles. When you go down to the sizing, the ultra-fine particles comes into picture, and that is where the most critical stage comes when it comes to the indoor air. Because indoor air is, you can control the coarse dust by putting some G4 filters or pre-filters in your HVAC systems. But when it comes to fine particles and ultra-fine particles, that becomes more a lucrative environment of indoors, and that is becoming a more dangerous zone for us to handle and to take care, because it's not only impacting your lungs, throat, nose, eyes, but it is starting impacting your heart, brain, and kidney and livers. So that is how the impact, even the virus is nothing but the particle which has some size. Different viruses have different sizes, and it becomes active when it gets in touch with the human cells. So that's the kind of ranges I just want to bring down to your notice, and that's how the virus is denoted, as you have seen in the ultrafine particles range. When we talk about the coronavirus, the size or the dia of the coronavirus is ranging from 0.04 to 0.14 micron. From the different laboratories in Russia, in Italy, in Switzerland, and in US, they have started giving the ranges of the sizes. That's why I'm putting down this range in front of you, that coronavirus has a specific size ranging from 0.04 to 0.14 micron. Just wanted to show you that how the lungs are getting impacted if you stay in New Delhi on your right hand side of the screen, and if you stay in some Himachal Pradesh kind of a state, and this is some 8 years back pictures which have been taken by esteemed Dr. Naresh Trehan of Medanta, and he has shared with us while we were starting this operations in India, and he has shown this picture to us, and we were like, and this is a live picture. So you can imagine that what a non-smoker can get from living by living in these cities and in these indoor spaces. Sometimes we forget about some pollutants, and sometimes it is a matter of time that you need to understand that why you are feeling lethargic, why you are every time making an excuse or making a complaint to HR that I am feeling very drowsy, I'm feeling headaches in the office spaces. Why that is so? It has been clearly stated, and thanks to some years back, IGBC also, where they have called Dr. Joe Allen from Howard Center of Health and Environment from US, who has explained very clearly that CO2 levels, higher CO2 levels can cause all of this, and this is becoming an issue in most of the buildings, and especially where the buildings where we don't have any ventilation, or we have very minimal ventilation according to the standards or according to the green building norms. So this needs to be taken care also. While we are talking about the other contaminants in the previous slides, CO2 is a major contaminant which we need to focus on, and we need to think about this parameter while we are considering the solution. Just to give you a context that how many deaths have occurred, and this was the data prior to 2010. The red dots shows you immature deaths from the PM 2.5 levels in US. So blue shows that no deaths or zero deaths or very less deaths, but red dots are showing that there are deaths in these cities or in these places. Sources from Joshua Apte, very good scientist in air quality and doing researches. Here in front of you, you can see the map of India, and I can't see any blue dot. So here the problem is that we understand and we take as a clear understanding that we need to focus on every bit of city, on every nook and corner of the city, especially where I'm living. I need to ask myself that, am I living in a good space, healthy space? I need to focus on my wellness. This is now your health, and you need to focus on your health. Long-term exposure to air pollution is actually linked to higher rates of having infections like COVID. And COVID is, and these are some latest papers which have been published by research bodies like Harvard, Chittaranjan National Cancer Institutes, University of Siena, and Northern Italy, and they are relating it with the presence of more pollution, having more cases of coronavirus. And we have seen in the past that wherever we have higher kind of pollution or PM 2.5, there are this is going to be more risky area if we compare to the infections which we are getting. WHO is revising every year. They were focusing on PM 2.5 levels, and they have revised this year that earlier 2005 levels were 10. When I take about annual average of a normal city or a normal indoor space, now they have given us a very, very clear understanding that no, the 10 is also not healthy, I would say, and 5 is becoming a new normal. So for us, we need to focus on new normals while living with the good standards of air quality, and we need to focus on these numbers when we are talking about new spaces. Where the question is, we are very clear that why we need to focus, what is the impact on health. Now, where we need to focus and how we need to focus. Managing indoor air qualities. Sachin was mentioning about the kids while they were going to the school. He generally asked them that what was the air quality in the school, classroom, anywhere they go. But we need to be very careful while we are talking about the indoor spaces. You as designers, you as architects and consultants, I would request all of us need to be now starting focusing parallelly on the wellness of occupants as well. And that becomes a major issue when it comes to the overall business cycles, overall revenue, overall cost of the company. And that gives you real ROI in terms of any small scale business, large scale business, anything which comes on board. That is the best part, that if we start calculating by that logic, I think we are in a win-win situation. Schools, hospitals, hospitality, you go to the hotel, restaurant, you find good air quality, you will feel better, and you will have number of hours, how many hours you live in good air quality. That is the important, and that is the key to today's world. And if you go to the office, you spend almost 8 to 9 hours in your office. You spend 8 to 9 hours and 7 hours sleep in your house. How do you calculate that? So air quality is important in your schools because children, especially the kids have higher respiratory rates than the adults, and they have to be taken care with the utmost care, I would say. And that is where we need to focus on. Of course, your bedroom, where you sleep for 7 hours. And nowadays, if work from home is mandatory from some of the organizations, then it becomes necessary to take care of your houses and especially the bedrooms where you spend most of your time. Office. So these three major, I would say, the spaces where you need to focus on air quality. Now, in these three spaces, how the bad air is coming into your building. What are the sources? How you are getting bad air? Bad air is always outside. But what makes it so different that indoor, nowadays people say indoors is worse than the outdoors. Why? What is the reason? So the outdoor air supply, which Puneet was mentioning about that we increase the fresh air supply, but fresh air is no more fresh. That is the question. That is the challenge in front of us. The wrong filters are installed in the HVAC systems. People are having lack of knowledge on the systems installed. I'm not saying that lack of knowledge on their basics and their understandings, but lack of knowledge on the systems installed. You need to understand your systems in the minutest detail of that system, and you need to take care of the operations as well as the occupants' needs. Otherwise, there will be a mismatch. How you are doing pressurization of the spaces, whether it's a positively pressurized space, whether it's a negatively pressurized space, whether it's an isolation room, whether it's a conference room or a meeting room for 5 people or 10 people or 12 people, how you are taking care of your air conditioning. And that is where we are getting the source of bad air. Then the construction part, the building fit outs, the construction residue, where we generally, if we are following green building norms, then it's okay. And then it's, I can assume that most of the construction residue and the waste material is going out in a proper manner. But when it comes to a normal construction, I can see the lot of filth is, there on the side, and coarse dust particles are coming inside your building while you're opening your doors and windows. Envelope infiltration. In India, till today, the infiltration from the envelope, from the windows, from the glass, from the ceilings, there are infiltration. We need to keep in mind while giving the designs and the concepts to the builders and to the contractors. Doors and lift shafts of the buildings. How we are making purely sealed doors? Are they properly sealed? Are they properly latched on top of the frames? What are the specific needs of the lift shaft so that no air, no bad air can come inside your building? What are we doing about that? Is there any incremental negative pressurization? How do we control that? Exhaust systems need to be active and non-active as per the needs, so that my energy and IAQ is balanced. Then comes to the operations. How my people need? What is the need of people? Do they need temperature ranges of 27 or 24 or 21? In which city I'm living in? What kind of RH values are needed? And of course, the kind of materials which we use. And green building has different chapters on in every rating system that takes care of the material. So I don't want to go into details, but at a large, if I look at all these problems and I have tried to capture in one screen, then airborne particles is one of the problems. Odors and gases are the second problem. VOCs, which are coming out from your material, is the third problem. And of course, the microorganisms like fungi and virus and bacteria are the fourth problem. And we need to focus on these. World Green Building Council says that people are the most valuable asset of organization, and efforts to improve IAQ can improve health, well-being, and productivity and profitability. So we need to talk about, whenever we are talking about productivity and profitability, we need to think about what kind of health and what kind of well-being spaces we are giving to our occupants, to our office co-workers. How? So we have learned about why and where. Now we are going into the last phase of the presentation. How we can do this? Is this possible? When Puneet was starting this webinar, he was talking about some addition of some filters. Are we dependent on these filters or not? Yes, we are dependent. We are responsible for reducing the burden on outdoor air as well. And when it comes to indoor, since we are living in indoors for 90% of our time, we need to think about these solutions and we need to keep ourselves engaged. And obviously, communication is one of the keys. And communicate with your colleagues, with your co-workers, that how you're feeling in weeks time or 10 days and 15 days. Take the checklist and make sure that checklist is going to every employee of the company and gives you the data that how he is or she is feeling when you are doing some corrections in your building. Whenever you say that these need to be done, if you are doing those in a well adopted manner, then you need to ask and take the feedback from your employees. That is the best key, and that is the way forward when we are talking about the solution. So let's come to the solution. I have mentioned some of the bodies and associations where they have given us very clear guidelines, and including IGBC, thanks to IGBC core team, technical team, where they have adopted some of the systems and given us the directions that how to follow these directions and in which kind of building, what kind of systems have to be implemented. So I'm talking about more in the areas of schools and homes and offices. Enhanced ventilation, yes, it is required. Enhanced ventilation, it does not mean only the fresh air or the outside air is directly coming into your spaces, but yes, it needs to be filtered with right stages of filters. It needs to be filtered with respect to the city where you're living in, and it needs to have some kind of smart systems in place and the controls so that your system doesn't deviate from the energy efficiency, because we are talking about sustainable environment. As a whole building environment, I can't leave sustainability aside and take care of only employees. So I need to balance both the things and do the right systems. Then obviously the current monitoring, the spot monitoring is always okay. But when I say that real-time continuous monitoring is something which we need to do, especially for the CO2, so that your ventilation rates are checked and coming back to you as a continuous monitoring, and you are getting right data from every zone of your building. Of course, there is requirement of HEPA filters. I would say the certified HEPA filters, when it comes to the certification, many people leave aside and they talk about certifications later on when they have already procured something. But it is best to do your analysis, to do your studies beforehand so that you get a right kind of filter as per your facility, as per your system's design. So ventilation cum filtration systems. How do you make the choice and what kind of systems you should think about? I'm just giving you the overview, and if anybody has more questions on anything, you're most welcome to contact me. It should be energy efficient, as I said. So the fans or the systems which needs to go in place, you should be very, very clear where I'm putting fresh air sources and how I'm putting in fresh air to the building spaces, and how you're getting connected it to the main HVAC system. The system should not make higher noises, as acoustic is one of the parameters. The filter selection has to be done as per the city's environment. Filter maintenance indication is very, very important in these kind of filtration system, because when I'm putting a system in Gurgaon or Faridabad or Noida or Delhi, then I need to have those indication system. I can't have one or two dedicated person to see the filter conditions every day. Of course, we need to talk about and we need to purchase and procure certified particulate filter, where Eurovent certification is the utmost certification in this area, and you need to focus on how they are certifying, what kind of laboratory reports are coming to your table, and then this system is capable enough to get attached to your existing BMS or not. What kind of systems are needed when you want to control it, or when you want to make it a self-controlled system or automated system? So that becomes a key. Of course, the safety and the protection switches are always the part of these kind of solutions. When it comes to the solutions, when your ventilation part is over and you are in a well ventilated space with some kind of controlled filtration, then you make sure that you have HEPA filtration inside, and isolated HEPA filtration. Why they are needed? Because to control the infection or the pollution which is coming from the humans. When I'm walking inside the office, my shoes are carrying dust, my clothes are carrying pollens, and I might carry some virus or some bacteria. So that is how, and your printers, your everything, bookshelves, your furniture is adding VOCs. So all of this need to be removed then and there. So wherever the source is, I need to put some filter and I need to put some purification system. What you need to think about that your filtration units are ozone free units, and they are not creating any byproduct like formaldehydes and ozone, and they are coming from a certified laboratory. The filters are coming from certification body, and they are individually tested. When it comes to all of this, the solution is in place, ventilation is in place, air purification is in place, then it's the time to monitor it and to control it through that monitoring system. It's the holistic approach towards any kind of air filtration system. So when it comes to monitoring, I need to focus on PMs, I need to focus on VOCs, I need to focus on CO2. These are four major parameters which I need to take care in terms of air pollution. But what I cannot leave aside is temperature and humidity, because that also plays an important role when it comes to the airborne transmission of COVID or any other virus through the air. So your RH levels.
Well, sorry to interrupt. We need to conclude because there are a lot of questions which have been coming in. Yeah. So
This is the last slide.
Yeah. Okay. Thank you.
This is the last. So the usage and the occupancy comes along with the control system, and we need to continuously check CO2 levels and PM levels. And then that system would take care of my ventilation and filtration units. And that is the whole building system, which is automated, which is self-controlled, and you are getting your quality of air in hand while talking about any building, any space. And this is how this is created. Central dashboard, given access to the employees, to the admins, and then they can control the systems. Obviously, use of passive filters, no production of harmful chemicals, especially the ozone contaminant and the ultrafine particles should not come out of the solution. So we should focus on some kind of solutions are there in the market, but we need to be focused where we can say that no harmful byproduct is coming out of my purification system, whether it's an ozone, whether it's ultrafine particle or formaldehyde. So productivity rates have gone up, whether it's a crisis response, information usage, or even a strategy input. And we have seen seen in well-ventilated buildings that how it has affected our systems. Even the CO2 matters, and that's how the oxygenated clean air can increase. Everybody knows blood oxygen saturation level nowadays, SpO2, and oxygen saturation level goes up by 1% if you spend your 10 hours in a clean air room and with lower CO2 values. Thank you very much, Puneet. This is my concluding slide, and I just want to mention here that where I'm coming from, Breathe Easy, incubated under Paharpur Business Center, which is the healthiest building of Delhi, awarded by Central Pollution Control Board. And with the experience of 3 decades, this building has been, icon and idol for many other sustainability features. And that is how we differentiate and we making a difference in people's health and well-being. That's our vision. So with this vision, I would like to conclude and see that if I could answer the questions. Thank you very much. Over to you, Puneet.
Thank you, Vaibhav. Thank you very much. That was quite inspiring, and talking about that how the pollutants can make a lot of impact on our own health and well-being, and how to mitigate these pollutants from our daily routine. Whatever has been possible, that's going to be appreciated by everyone. Yeah, thank you very much, Vaibhav. Now, I would like to invite Mr. Sachin Sharma, Chairman, IGPC Western UP Chapter. We've been seeing many of the questions in the Q&A boxes, so would request Mr. Sachin Sharma to take this Q&A session forward. In the meantime, request all the participants to may use those Q&A. We would like to take as many as possible. Thank you.
Thank you, Puneet.
Okay, Mr. Sachin. Yeah.
Thank you, Puneet. Thank you, Vaibhav, for a very interesting and a detailed presentation. And it has really given us a very great insight into this particular issue, which is a hot topic these days, And these real insights will help all the policymakers and all the stakeholders to really devise the ways to tackle these particular issues. So we have a couple of questions here, which we would like Vaibhav to respond on. So the first question is from Megha Singh Chauhan. So the question says, to create the awareness, one should project models in the colleges. Any suggestions you have on those probable models? Vaibhav.
Megha, thank you very much for this question. However, the model is in front of you, and the model is very simple. Thanks to Microsoft and thanks to Apple, that they show in a taskbar the AQI value wherever you are opening up your laptops. So the model is there, awareness is there. You need to pick up your model alone, and you need to start off with that model. And secondly, when you talk about the model, when it comes to the air, the subject of air can't be learned or dealt in a model specific way. It needs to be created. The environment has to be created. I would urge that your college or your university should give a path, or should take a lead and make one room at least with a clean air room and the good air quality. Show it to the other occupants, show it to your co-lecturers, show it to your co-workers, co-colleagues, and then give the example to others. And this is possible. Earlier people thought that this is not possible. When we have achieved in Delhi NCR, when people start coming into our buildings, and then they have shown, and then they have seen that this is possible, and that's the live model. So AQI is in front of you on your screens, and when it comes to the live model, I would urge that uh, every employee, every coworker from this panel should take a part and should observe the air quality inside their offices.
I hope this is very well answered. And to add to this, what Vaibhav has explained, there are a lot of campuses across India which has taken a lead in creating a sustainable campus. They have taken a lead in not only, at a operation stage, but at a design stage, they have gone into IGBC certification, and they have laid a lot of emphasis on these sustainable items like indoor and outdoor qualities, and they have adopted a model where whole campus becomes sustainable. I think those campuses which are not yet rated or are not sustainable, they should go for ratings like IGBC to take it forward, so that all the students also learn that what are the footprints as an individual they are living in the campus, and what footprint this campus is giving to our environment. That is very, very important. Thank you so
I
much.
second that. I second that.
Yeah. So the next question is from Mr. Amit Raj. What Amit is saying, that there is a surge in the sales of air purifiers all across, and what would be the key checkpoint before buying one?
The key checkpoint I have mentioned in my slide also, that the efficiency, the energy cost of that purifier, the operational cost, how you are running that purifier, what kind of filters you are using, and which city you are living in. Your city has a lot of gaseous pollutants, so you need to take care of gaseous pollutants. You can go down on PM 2.5. If you are living in Delhi NCR, I would say both of the contaminants should be looked on, gaseous as well as particulate matter. So you need to select your filters according to that. And the third most important is certified filter. You need to check with the manufacturer that what kind of certification they are giving you with the filter, specifically the filter. The machine can be certified by CE, by other agencies, but that's not the certification of the filters. The filters are actually doing their job, and that needs to be certified.
Great, thank you. So there is another one question from Mr. Rajesh Verma. He's saying that CO2 monitoring breathing level is fine. The challenge comes at existing setup uh, at the time of integrating with AHU for automated operations for enhanced air intake. How do we handle that kind of scenario?
Yeah, so challenge is there. I agree with him that challenges are there in the existing building, but 90% of my projects are existing buildings. So I don't feel that as a challenge. And we have been successfully doing and giving the systems which are automated, which are synchronized with your existing AHUs, and those can be operational within a month or so as per the scheme suggested. So it's challenging, but we as experts, when we go on to table, we can take care of that, and I can have a separate discussion on this with him.
Okay, perfect. So I
It's
have one
possible.
last question, Vaibhav, which is from my side, which will be quite interesting to everybody also. So all the technical initiatives, whatever we can take in terms of improving air quality, that's fine. But there are a lot of initiative which people have taken in terms of creating a green landscape inside the buildings in their houses, in terms of taking up indoor plants and how much it impacts the indoor air quality. Is this initiative which is quite worth looking at from a household perspective, from office perspective to start with, before we invest in large term assets in terms of putting and improving indoor air quality.
So improving indoor air quality through plants was the initiative by Paharpur Business Center. As you might be aware, that building from where we are coming from and where our headquarters are. So it's the part and life of that building and lifeline of that building, I would say. We have 7,000 plus plants, indoor plants, which includes Sansevieria, Areca palm, and money plant. And those are the three plants which gives you clean air environment. And that's the 50,000 square feet of a building. So you can imagine with 50,000 square of a building, I need 7,000 plus plants. So how much square feet you are living in and what kind of plants you are growing in. And the most tedious part with the plants is, yes, you can do it if you have space, if you have time to nurture them. I always say that put indoor plants, put outdoor plants when you can nurture them. Don't just put them in a corner and leave them without care. So they need care, they need maintenance also. So I am fully in agreement with you. Indoor plants helps, and we are creating our indoor air better and better day by day because we are adding one plant or the other plant every week. So there are 7,000 plus plants in our.
Yeah. Thank you, Vaibhav, for this wonderful answer. And with this, I would like to conclude this session because we have time up and running. And I would like to conclude by saying that buildings are primarily built for the benefits of its occupants. And we wish that all the buildings are certified as healthy and which should focus on occupants' health, happiness, which improves the cognitive abilities and productivity of the people who are staying or working on those buildings. And as very rightly said by Vaibhav, that wellness is extremely powerful elements that can play a very, very significant role in occupants' engagement, productivity, talent retention, creativity, and even innovation also. So I think the way forward is that all the buildings should be rated properly and all the stakeholders should join hands with the urban planners to make it sure that these guidelines are incorporated in all the rural and even urban areas across India so that indoor air quality becomes a mandate to be incorporated in the design element. And we wish that this principle is followed by all the stakeholders. And thank you so much for attending this event. And I would like to thank you all the participants and Mr. Vaibhav Goel to be a part of this event. Thank you so much. Thank you.
Thank you, IGBC. Thank you, everyone, for patiently listening to me. Thank you.
Thank you. Thank you, Mr. Vaibhav. Thank you, Mr. Sachin, for
Have a good
being
air.
with us. Just wanted to,